This podcast is brought to you by Meteorate.
Ladies and gentlemen, we have now signed a proclamation that we will be starting all our Seriously Funny podcasts off with a joke. Ideally, jokes to do with health, medical and well-being. This week's joke, Ross, and welcome, is from that iconic film Flying High. In that scene where all the passengers are keeling over with food poisoning, the captain assesses the situation with the sick passengers and then tells the flight attendant, if we don't get these passengers to a hospital within the next few hours, they'll all be dead. The flight attendant then asks the captain, but captain, what is it? To which the captain replies, well, it's a big tall building with patients, but that's not important now.
Yeah. Surely you can't be serious. Don't call it surely. Yeah, I know.
I love those. I love those jokes. Okay, so let's start off. Are you well, Ross?
I'm well. I'm well.
It's important to be well at a wellbeing podcast. So what are we talking about now? The future medical news. Melatonin and macular degeneration.
Yeah, well, let me say there are two types of macular degeneration: age-related dry macular degeneration, which is the common one, and the wet macular degeneration, which is less common and is caused by blood vessel aberrations around the macula. And that's treated with injections into the eyeball. Imagine that one. Whereas the dry macular degeneration, we haven't really had great treatments up to this point, apart from a group of multivitamins put together along with what we call the carotenoids such as zeaxanthin and lutein, which have had some benefits in the treatment of macular degeneration. Now, this interesting study of around 200,000 older patients followed between 2008 to 2023 showed that those who had the highest levels of melatonin in their bloodstream had the lowest rates of age-related macular degeneration. So they did another study of 121,523 patients over the age of 50 and found that those who were taking melatonin had hardly any age-related macular degeneration, and those who already had established macular degeneration who started melatonin, there was a slowdown in the progression of the condition. So let's look at melatonin. What's melatonin for? It's not a sleeping pill, but it's to reboot your sleep-wake cycle. So when I do my overseas trips, I look at the time zone I'm going into, and I take the melatonin into that time zone. To give an example, 11 o'clock Sydney time, I'm flying to Los Angeles. So immediately get on the plane. It's 5 o'clock in Los Angeles the day before, 5 p.m. in Los Angeles the day before. So you then say, okay, I'm working at 5 p.m. time, not 11 a.m. time. And when it gets to around 9 p.m., that's when I take my melatonin, and I'm a lousy sleeper, so I take a few sedatives as well, bomb myself to the eyeballs, and I'm out to it for 7 to 8 hours and don't get a lot of jet lag when I get back. But melatonin's pretty harmless. It's not a drug. It is a supplement that's secreted from a thing called the pineal gland at the back of the brain to order the sleep-wake cycle.
So apart from red wine, which has got melatonin in it,
not much.
What is the highest food source for melatonin?
Oh, not much. There's not a lot of foods that have a huge amount of melatonin. You've got to take it as a supplement. So I think as you get over 50, it's not going to hurt you at about 8, 9, 10 o'clock at night to have a bit of melatonin, because melatonin is released when things go dark. And this is why it's really bad to sleep with lights on or with a lot of lights streaming into your bedroom. Yeah. Because let's face it, we were designed to live as cavemen. So you'd go to sleep in the cave, it'd be pitch black. A lot of melatonin, good sleep. Yeah,
so I always wear nightshades.
Yep, that's a good
eye shade. Do you do that?
No, I don't, but it's a good thing to do.
Okay.
But so what I'm saying is just some evidence why melatonin's a good thing to take, and strangely, it protects your eyes. That's melatonin. Yeah. Let's move on to the future.
The future, oral insulin.
Yeah, now this is really interesting stuff. This has come out from the University of Sydney in conjunction with the University of Norway. Yeah, and they've only done this in experimental animals in mice at the moment. Haven't as yet moved to humans, and they're going to be doing the studies in humans very, very soon. So this is an oral insulin. Okay, so we're talking about people taking insulin orally rather than injecting themselves. You think, well, oral's not as strong as injection. No. In this situation, it's better than an injection for a few reasons. Let me tell you why. You're absorbing the insulin. It goes through the stomach, so it's not broken down by the stomach acid. It's in a nanoparticle, absorbed directly into the liver circulation called the portal circulation, goes straight into the liver and works almost like a pancreas. So if your sugar level is normal, it doesn't drop it anymore. So there's no risk for hypoglycemia that has been shown in experimental animals. But if your sugar level's high, then it'll drop it back to normal. So it actually works better than when you inject yourself into the tummy or the leg with insulin. It's got to circulate through the whole body and then work a little bit where it needs to work, which is around the liver and the pancreas.
But why am I not surprised by oral insulin when you reveal that? Isn't it like, doesn't food affect blood sugar?
No, it does, but it's a totally different thing, you see, because insulin is a very large protein. So when proteins get into the stomach, they get broken down by stomach acid. So what very clever people at the University of Sydney and Norway have discovered is a way of protecting that insulin in a nano coating so it doesn't get broken down by the stomach and it just gets released in the small intestine directly into the liver and the pancreas region to work there. And interestingly, in the animals they used it in, no side effects, but it worked beautifully. So we're talking about not too far away. The future of diabetic management is to have a little patch on your arm that's already there called a Libre Freestyle Monitor that monitors your blood sugar level all the time. And it actually, you just put your phone up under your arm like this where it is, and it gives you a blood sugar reading rather than this pricking the fingers all the time. And rather than injecting yourself with diabetes insulin, the injections, you just swallow the stuff when you go to eat.
Amazing.
So we're talking about a revolution in the management of diet. And it's not far away. They just need to do some human trials. So there's the future of medicine for you.
Okay, now we've got the body of evidence. This sounds like a joke, Dr. Ross. Viagra and dementia. Why am I thinking, did you remember that you had an erection?
That's the old joke about the guy that goes to the doctor and the doctor says, look, I'm sorry, sir, but we've mixed up your wife's blood test. We're not sure whether she has AIDS or Alzheimer's disease. And the guy says, what are we going to do? He said, well, when you go home, send her for a walk around the block. If she comes back, don't make love to her.
Okay. What's this connection between Viagra and dementia? Dementia.
Okay. Let me say that 12 months ago on my radio show, shameless plug for Healthy Living 7 to 9 on a Sunday night.
Great show.
But I spoke about a trial of 72,000 men over the age of 50, followed for 14 years, who were the highest end users of what I call vitamin V, which is Viagra, or Cialis, which is the longer acting version of Viagra. And they found in this study that those men who were the highest end users of Viagra or Cialis, for other reasons, of course, good old erectile dysfunction, as I say, for all us men over 50, everything stiffens up apart from the bit you want to. And so for the men who were taking vitamin V and or Cialis on a regular basis, they had a 55% reduction in cardiac events and a 50% reduction in all-cause death.
Right.
But some of the studies have shown a trend towards reduced dementia. Some say 20% reduction, some even say 70% reduction. And in a study of experimental mice who were genetically primed to bowel cancer, those who were given Viagra had a 50% reduction in bowel cancer just by doing that. So this new study out of the University of Oxford gave people, and this was only a 3-week study, they gave them either Viagra, placebo, or another drug, which was a bit of a vasodilator, and they found that Viagra had the best effect of improving the blood flow to the skull. And part of the generation of dementia or Alzheimer's disease is a reduced microcirculation. So the reason why vitamin V or Viagra is so good for you is because it improves the blood flow to your skull and washes out all the accumulated rubbish. So every time you have a thought or an emotion, there's a waste product created, which needs to be washed out of the brain. So just like if you don't wash all the scraps off your plate after you've eaten, the scraps get stuck to the plate. The waste products get stuck in the brain, and those waste products then take over the normal action of the brain. So
because we know a lot about creativity is thinking differently, and when you do so, you create new neural pathways in your brain.
All of the above.
Is it working in a similar fashion to that?
Yeah, it's just giving you better blood flow. It's a bit like why exercise is so good for you in every aspect. People who exercise regularly have less dementia because they're flushing blood through their brain, through their muscle. And so you think of it logically. Anywhere there's stagnation, if you have a stagnant pool, you get accumulated bacteria and rubbish in that area. If you're flushing the thing through, the water's much purer. It's the same thing with your brain. Simple principle. There you go.
Okay, so now we've got controversies: vitamin C and melanoma.
Yeah, this is a really interesting one because again, and this is a theme of what we'll be talking about in podcast after podcast. Conservative medicine believes if you can't fix it with a script pad or a scalpel, then it doesn't work. Yeah, and there's often this. I hear so many conservative doctors say all vitamins do is give you expensive urine. I agree. What you don't need, you urinate out. But what it also gives you is very valuable blood. And so to me, I think supplementation is an important part of being healthy. But as I say all the time, 80% lifestyle, 10% drugs if you need it, 10% extra benefit from supplements. But they're called supplements because they're supplements to high quality drug therapy or procedures and most importantly, high quality lifestyle. So this study only looked at melanoma cells. So it wasn't done in humans. It was done in melanoma cell lines from humans who had, so this was in the laboratory. And they found that when they added vitamin C to standard chemotherapy for melanoma, it actually improved the killing of the melanoma cells. And interestingly now, they're using vitamin C in some intensive care units for people who are very, very sick. And it stimulates the immune system, making the immune system work better. So I just think it's an interesting topic to bring up that we're now, rather than having us or them, this is what I call integrative medicine. Yeah. And I'm one of the major proponents in this country and around the world of integrative medicine, which is lifestyle medicine, taking the best bits of orthodox medicine with the best bits of complementary medicine.
But I've got to ask you this, Ross. Why are doctors and the medical fraternity reluctant to embrace things like vitamin C when there is almost evidence-based criteria out there, especially with vitamin C and its role in tackling certain cancers and actually killing them almost as a standalone treatment with infusions? People's lives have been turned around without chemo. And sure, there's a complementary effect that vitamin C is having in conjunction with things like chemotherapy. But why are doctors so reluctant to take that on board? Is it because of their connection with the pharmaceutical industry?
No. Look, so many people are pharmaceutical company bashers, and I'm not. Yeah, okay. The pharmaceutical companies do their job. Their job is to research and flog drugs. That's their job. It's the job of the medical profession to be the gatekeepers to say this drug is appropriate for this condition, this drug is not appropriate for this condition, based on the evidence that I've read from the research that's been done on the medications. Now, I think the reason is, and I think people are getting this wrong, firstly, you'd have to ask them why they're so against this stuff. And I can tell you that what they'll say is because there's no good evidence. But you see, drugs are like a high-performance motor car. Get you from A to B very quickly, but with the potential of crashing and killing yourself on the way. So you've got to have seatbelts, safety mechanisms in the car, and road rules you must follow for that driving to be safe. Whereas supplements are like bicycles, get you from A to B much slower, but all you have to do is wear a helmet and keep away from cars and not breathe in the pollution, and you get some exercise along the way, but it takes you much longer to get there. So you need different rules for the drugs than you need for the supplements. But you see, doctors say there's no hard evidence, no randomized controlled clinical trials to show that drugs reduce your risk for heart disease, sudden death, etc. There doesn't need to be, because they're not pharmaceutical drugs with the strong side effects. All there needs to be is surrogate markers. So, for example, if you were to bring in a cardiac supplement, such as the bergamot products I talk about, all you need to prove is that they keep your cholesterol healthier, that they reduce your risk for developing diabetes. You don't need to prove that it stops a heart attack or whatever. Just show that it does what it's supposed to be doing without causing harm to people. And the evidence is overwhelming for that. This is just yet another evidence that vitamin C works. But also, there's a wonderful saying, Homer, that science advances funeral by funeral. So the problem is people are stuck in their conservative ways and can't get outside of their conservative habits and their conservative thinking. And there has never been a monument erected to a critic. And that's the problem.
In my books, the Hippocratic Oath by most GPs is do no harm.
That's the first line. That's the
first line, do no harm. Surely if there's the prospect of pushing things like vitamin C before pharmaceuticals, wouldn't that be the preferred option?
Well, that's what I tend to do, but again, that's not accepted practice by my colleagues. And look, I think it's a bit sad, but that's how people do things. So let's move on to the next thing,
which is
just the thought of the day.
Yeah, what is the thought of the day?
Well, the thought of the day, just a straightforward thing, and we'll talk more about this. And we've mentioned it a bit before, but we'll talk more about this as podcasts go on. But the thought of the day is a third of Australians are vitamin D deficient, despite the fact that we are the skin cancer capital of the world, because vitamin D is the sun vitamin, of course. But because we live now a very sedentary indoors lifestyle, a third of people are deficient in vitamin D. I'm not suggesting we get out in the sun and get sun cancers, but I am suggesting we look at why we're vitamin D deficient and do something about it with low-dose supplementation. So my strong advice to everyone, I believe once you get to about 45, 50, you should be taking 1,000 international units of vitamin D, 2 small capsules every day. Just to give you one example, one study out of America, 25,000 people over 5 years, showed that taking 2,000 units of vitamin D daily reduced your risk for autoimmune disease by 25%. Something simple.
Okay. Interestingly, like someone like myself, best time to be out in the sun and the best time to get the vitamin D is between 11 and 1 p.m.
Yeah, as long as you're not there for too long. And you can get a good dose of vitamin D by about 5 to 10 minutes in the sun during those times.
Yeah.
But again, you have olive skin, a rather unusual Greek name. And so people with olive skin or darker skin need a lot more vitamin D than somebody who's plethoric like me. So it's a completely different scenario there. But I just take my 2 vitamin D a day and I avoid the sun because I've already had a couple of skin cancers and the sun has been a bit damaged the skin's been a bit damaged by the sun over the years. So there's our intro of the news of the week.
Yep.
Let's move on to our topic of the week.
Well, the topic for this week, Ross, is the subject of the obesity paradox.
So the question is, you've got to ask yourself, what is the obesity paradox?
Yeah.
And I actually believe it's called the overweight paradox. I'll get to that in a second. But we look at 40 cohort studies where they put together an analysis of 250,000 participants and found that those who had a BMI between 25 to 30, so BMI, for people who don't know, is your weight in kilos divided by your height in meters squared. So we consider normal 20 to 25, overweight 25 to 30, grade 1 obesity 30 to 35, grade 2 obesity 35 to 40, and morbid or grade 3 obesity above 40. So the people who were in the overweight range, 25 to 30, had a 13% reduction in all-cause death, a 12% reduction in cardiovascular disease compared with people who were in the 20 to 25 category or compared with people in the 30 to 35 category. And so it was better for people to have a little bit of weight compared with being thin. But then an even bigger study where they put together 97 trials of 2.9 million people, and they found a 6% reduction in overweight people, 25 to 30 BMI, compared with normal weight and grade 1 obesity. But whatever, it's showing that being a little bit overweight, and this is for people over the age of 50, Homer.
Yes.
For people over the age of 50, it doesn't hurt to have a tiny bit of fat around the belly.
Yeah.
So what do I say to my patients? I'd much prefer them to focus on eating healthy food and doing regular exercise than being too fixated on whether they've got a tiny little bit of fat around the belly. Once you get to the obese stage, that's a different issue altogether. Now, interestingly, some of the evidence was much more striking in people who already had high blood pressure, reduction in death, heart attack, stroke, 23% in overweight patients. Strangely, a 32% reduction in those who had grade 1 obesity and a 24% reduction in those who had higher grades of obesity compared with people of normal weight. Another study from Holland in people who had coronary stenting, about a 41% reduction in people who were overweight, not obese. But it does show that once you get above 35 BMI, which is grade 2 obesity, forget it, shut the gate, the horse has bolted. That's an 88% increase in death rate. So no one is suggesting, and I'm certainly not, that obesity is good for you in any way. I'm just focusing more on overweight people. But you've got to ask yourself, sorry, go for it.
So is obesity measured with through fat or muscle? Muscle weighs more.
See, this is the problem.
Yes.
If you look at high performance athletes, so look at first grade footballers or whatever who've got a huge muscle mass, they would be considered obese by this definition. So I think a much better assessment is what we call relative fat mass.
Yeah.
Relative fat mass is a pretty simple equation. 64 minus your height divided by your waist circumference.
Mm-hmm.
So that's the relative fat mass. Sorry, 64 minus 20 times your height divided by your waist circumference for males. Yep. And for females, you've got to add 12 to that. And that gives you a percentage body fat. So for females, their percentage body fat should be below 35%. For males, percentage body fat should be below 25%. So I think it's much better to look at relative fat mass, because I don't care about people losing weight. I care about them losing fat.
But it comes back to that old equation, especially for athletes, of the difference between being fit and healthy.
Yeah.
So when we see these marathon runners with virtually zero, I think they've got maybe 2 or 3% body fat, which is really low. Tour de France cyclists have got like 7, 8%. Olympic swimmers have got 11, 12% body fat. So that whole equation of it almost throws it all out, the whole obesity formula, when you look at
of course, but it doesn't.
For athletes.
It doesn't if you use relative fat mass, which is a much better indication as far as I'm concerned. But also, even then, to have a little bit of fat in your belly in our age group, 50 plus, I don't think it's a bad thing. I think what is the bad thing is to eat bad food and to not exercise. But let's look at, and I've listed here in my notes, if there's any possible explanation for this obesity paradox. And the most obvious thing is that people who are very obese, as I said, I call it the overweight paradox, not the obesity paradox.
Yeah.
People who are very obese, they kill themselves a lot earlier. So people who have more than grade 1 obesity, especially grade 2 and morbid obesity, they die anywhere between 10 to 20 years earlier than the rest of us. So by the time the analysis starts, they've already weeded them out of the system. Secondly, however, often people who are thinner than overweight people have some other disease that's making them that thin, and they're part of the analysis. Also, smokers tend to be thinner than people who don't smoke. Yeah. And when you smoke, you're chronically poisoning your body, and thus you're thinner. And so it could be that they're skewing the results to make thinner people look sicker than they actually are. Because again, I think people who maintain a good exercise habit and keep their weight down throughout their life are obviously healthier than people who are, say, close to being obese, BMI 30 or whatever, BMI 28, 29, but they don't exercise. So I think the key is the eating and the exercise. And also there are other things that chronic kidney disease can make you lose weight. So many other things here. So I really, the message I want people to take away from this is don't get so fixated on having a little bit of belly fat. Get more fixated on healthy living, the 5 things of healthy living.
But also the orthopedic surgeons will tell you that every kilo you're over is, I think, 20 kilos extra on your joints. Every kilo you're over, especially with knees. So that's an interesting, from a practical perspective there, it's a interesting view, you've got to strike that balance don't you?
I don't think if anyone's listening to this and they say they've got a BMI of 23 and they're thin and they say, oh, gee, maybe I should put on some weight so I can get into that category. No, it's rubbish. We're not making that message. The message I'm trying to make here that if you don't agonize over having a BMI of 27, especially if you've got a good muscle bulk, because that might be most of the reason why, do your relative fat mass. So I'll just repeat that. 64 minus 20 times your height divided by your waist circumference in centimetres for a male, and that should be less than 25% fat mass. For a female, add a 12 to that. So 64 minus 20 times your height divided by your waist circumference, and then add to that 12 for a female should be less than 35. So really, I don't believe the obesity paradox is real, but I do believe the overweight paradox is real for all the reasons we've dictated today.
And can you bring it down to the type of fat?
Oh, look, there's white and brown fat. White fat, most adults have white fat. There's only a little bit of brown fat in adults, and that's just under the collarbone. But whereas most of the fat we have as adults is white fat, whereas newborn babies are full of brown fat. So they're two entirely different things.
So if you derive that fat from things like avocado and olive oil, is that better for you?
Of course it is.
Okay.
So there are good fats and there are bad fats. So everyone says saturated fat's bad for you. That's nonsense.
Yeah.
If you swim in any fat, it's going to be bad for you. If you swim in any carb, it's going to be bad for you. Any protein, it's going to be bad for you. The point is we take in more calories in this society than we need to. So my advice to everyone is cut back their calories, cut back their carbs, and cut back their grog. That's the way to keep your weight down. And losing weight is 80% food, 20% exercise. A lot of fat people go to the gym hoping that that's going to be their salvation and they can eat what they like afterwards. All these cyclists end up in the pastry shop having their pastries at the end of the 50K cycle. I don't get that either. So I'm just saying the system is much more geared to sin than it is penance. So you go for a brisk half an hour walk, you burn 300 calories, have a small piece of chocolate cake, there's your 300 calories.
Yeah, okay, that's great. Fascinating subject, Ross, that one. Fascinating.
Yeah, it's a very, very interesting discussion.
Okay, now we've got some email questions.
Yep.
Ready to... this is from Barry in Melbourne. He says, hi guys, really love the show. Homer is nowhere near as funny as Ross.
Yep.
His dad jokes.
Barry.
His dad jokes are the best. Anyway, my question has to do with the urinary tract infection.
Yep.
My wife's doctor told her that men don't get UTIs because their anuses are way too far away from their penises. Is this true? And what is the best and most natural way to get rid of UTIs if they actually do exist?
Look, men do get UTIs. They just don't get them as often as women. And the reason being, it's got nothing to do with where the penis sits in relation to the anus. It's to do with the length of the urethra. So urethra starts from the bladder outlet down to the tip of the penis, or in a woman from the bladder outlet to where the little outlet comes just above the vaginal cavity. So no, the doctor's wrong. It's just the length of the urethra, which is very short in a woman. So especially if women, the best piece of advice I can give for women after sex is to pass urine pretty quickly when the event's over. because you're flushing any bacteria that may have accumulated around the outlet of the bladder or the orifice of the urethra, getting that out, flushing it out pretty quickly. But men can get urinary tract infections, especially as they get older. They don't empty the bladder as well. They get a bit of residual urine there, and some bacteria can still grow up into the bladder and cause a urinary tract infection. And also, let's face it, there are some sexual practices that some men do that can also increase their risk for getting urinary tract infections as well. That's another thing. So in terms of one of the important pieces of advice I can give people, the 3 rules of being a male over 50, very, very important. Number 1, never walk past a public convenience. So always, if you feel the need to empty your bladder, go and do it. Yep. Number 2, never waste an erection. And number 3, never trust a fart. And so they're very important rules to live by. But certainly don't let your bladder get too full, because that's when it's a stagnant. We spoke about stagnant flow anywhere, and bacteria can accumulate with that. Number 2, with that, if you are concerned about it, cranberry juice is a very good way, or cranberry tablets are a good way of keeping the bladder working well and reducing your risk for urinary tract infections. If you're having some problems with acid urine, there's a thing called Urale sachets, which keep the acid more alkali. And another thing is, with all of this, some women especially who are prone to urinary tract infections, sometimes you need to possibly, after you've had intercourse, you need to take a particular antibiotic. So there's one called nitrofurantoin, which you've got to get on prescription. I wouldn't be overusing it, but just say if you're having sex a couple of times a week, but you're very prone to urinary tract infections, take the nitrofurantoin after sex, which is a good thing to do as well. And some older, very older women who get a lot of urinary tract infections, even unrelated to sexual activity, may need a thing called Hiprex, which is a urinary antiseptic.
So can you get rid of UTIs without antibiotics?
Oh, look, usually not. It'd be very, very unusual. And if you're getting recurrent urinary tract infections, I think it's important to get an opinion from a urologist. That's URO, not neurologist, just to see why this is happening to you, because sometimes there are more serious causes of recurrent urinary tract infections that need to be investigated.
Okay. We've got another inquiry from George from the Gold Coast. Keep up the great work with the podcast. I have a question about frequency of colds and flus. I'm 55 years old, and during my younger days was given repeat doses of penicillin to combat tonsillitis. Would this have lowered my resistance to infections and make antibiotics that I take less effective, as I always get colds and flus?
Yeah.
So
look, firstly, can I say some of us are more prone to respiratory viruses than others. I'm a sitter for it. And I think one of the reasons was that when I was 5 years old, my mother had my tonsils and adenoids ripped out, which many people did in our age group.
Yes.
And doctors are now avoiding doing that, as they're avoiding taking out appendices as well. I've still got my appendix, but people who have their appendix taken out before age 20 have something like double the rate of heart attack and a higher rate of Parkinson's disease as well. It's just really weird how this happens, and that's a topic for another podcast.
Yep.
But some people just are genetically more prone to getting respiratory tract infections, as I am. 25% of people have what we call type 1 allergies, which is hay fever, asthma, anaphylaxis, urticaria. All of those things are in the type 1 allergies. And if you like me, have hay fever, then you're more prone to getting respiratory infections. So if I don't have the flu vaccine once a year, I come down like a ton of bricks with influenza. And I've got a 91-year-old friend who's never had influenza and never had a flu vaccine.
Yeah.
And it's interesting to say with COVID, some people have become very, very ill with COVID, even those who were seemingly very healthy. So 2 brothers in Holland developed COVID. One died, the other one developed severe COVID and was on a ventilator in their 30s. So they mapped their entire genome and found that they both had a defect in a thing called TLR7, toll-like receptor 7, which is an important part of the immune system that codes for viruses. So some people are just predisposed for it. Now, does that mean you just accept it? No. What I do, and this certainly helps me reduce the severity, intensity, and frequency of getting respiratory infections, I take a lot of supplements.
Yep.
And when I feel a cold coming on, I bump up my intake of vitamin C. So a study out of Finland showed that those people who took 4 to 6 grams a day of vitamin C at the onset of any respiratory infection markedly reduced the length and the severity of that respiratory infection. Vitamin C is a good thing. Zinc lozenges work in this situation as well. And there's a good old thing called echinacea, which is in a whole lot of different preparations. So I hit the vitamin C, I hit the echinacea, and I also hit the garlic, the kyolic garlic. So I had 2 of those twice a day to just bump up my immunity. And good old-fashioned spirulina, which you can get in a powder, which you mix into juice every day. Doesn't taste that great, but that also has what's called phycotines, which are strong immune stimulants.
So you've got to watch also the vitamin C intake, because I find I can take 11 to 12 grams a day, but that's short of having the effect on your bowels, where it actually works as a flush.
Yeah, look, even 6 grams a day can do that. And some people carry on, and I don't agree with them. Another topic for a podcast is kidney stones. But some people think that taking too much vitamin C can give you kidney stones. It actually doesn't. But that's one of the myths that people carry on with when they're criticising vitamins.
It's actually a cure for kidney stones.
Yeah.
They say, yeah. So we're going to have a quick plug now for the best wellbeing program for your business, which is the Global Business Camp, which is on February the 24th to the 26th at the Ground Plaza on the Gold Coast, featuring a sensational speaker by the name of Dr. Ross Walker, and apparently some shonky guy known as the Corporate Imposter, who they will both be featuring at this amazing event. And if you want information on it, just go to seriouslyfunnywellbeing.com and click on the Global Business Camp icon. Thanks to everyone for listening. I'm going to just close with a few medical dad jokes. Is that all right?
Please. Well, just before you do, I just wanted to alert people that this person has been stealing the wheels off police cars, and police are working tirelessly to catch them. Please go.
Nice one. A wonderful prelude. How do you follow that? Apparently Ross tried playing hide and seek in the hospital, but they kept finding him in ICU.
Oh, gee.
Ross also went to the library to get a medical book on abdominal pain, but somebody had ripped the appendix out.
All right. Yep. Good.
Ross also learned to never lie to an X-ray technician because they can see right through you.
Yep.
And as a medical student, Ross hated the test on kidney stones because it's apparently the hardest test to pass. So on that note, it's time to say goodbye to another podcast. Please feel free to email us at hello@seriouslyfunnywellbeing.com, and our website is, please follow, seriouslyfunnywellbeing.com. Thank you.
Bye.
Bye.